Hello, hello. This is Psych Adjacent. I'm your host, Dr. Thomas Hughes. I'm happy to be back for another week. Very quick announcements. In a few weeks, Dr. Cindy Duke, she's an OB-GYN, fertility expert, and a virologist. She'll be stopping by to discuss a wide variety of topics related to her field of choice. So be on the lookout for that episode. It'll be premiering in a few weeks. But today, with me here today is Dr. Erin Kinney. Say hello to the audience, Dr. Kinney.
Hey there, guys.
You ready to get started?
I'm ready to go. Let's go for it.
Fantastic. We're back. Hello, Dr. Kinney. I just want to give you a brief introduction so people know who it is that they'll be listening to today. So you attended Vanderbilt University for your BA in psychology. Anything psych related, I'm very happy to hear that. So you attended the University of Bridgeport for your ND. You are the host of a new podcast titled The Dr. Kinney Show. And you are also in private practice in Annapolis, Maryland. And we'll talk a little bit more about what it is that you do in practice. Did I get everything correct?
You did. That's awesome.
Fantastic. Okay. All right. So for anyone that is unfamiliar with naturopathic medicine, could you please describe what it is that a naturopathic doctor, what it is that you all do?
Sure. So I like to think about naturopathic medicine. We're trained as primary care providers, but we look at the body a little bit differently. So we have kind of similar tenets to a primary care, first do no harm in any situation, but we're looking at each body as an individual, and we want to figure out what's causing a symptom. So we're video, so this is great. I will often see if I have let's imagine that this is an upright punching bag. This is how I explain to my patient. So imagine that this is something, it's weighted at the bottom. If I were to punch it this way, it's going to go like this. If I were to leave it alone, it would eventually come back into balance. Are you with me?
Right. I'm with you.
Get that concept, right?
Mm-hmm.
So your body, when it's in kind of optimal health, it's upright. We don't have any symptoms, right?
Right.
Sometimes, let's say, for example, you get the flu. The flu is going to come over here and it's going to punch your body. And you're going to be over here. Mm-hmm. You're going to have fever, chills, you might vomit. All of those symptoms are indicative of your body trying to kill the flu virus, right?
Right.
So the symptoms and the body will eventually kill the flu virus and you'll come back into balance, right?
Yes.
So I just want you to understand that concept. Mm-hmm. So let's say that you are someone who gets chronic headaches. Something is causing you to have headaches. So you're over here, you're having headaches every day. And you go to your doctor and you say, hey, doc, I'm getting these migraine headaches. And the doctor goes, no problem. We've got a great drug for that. Here, take the drug. And the drug does this. It punches your body this way. The headaches go away. But now in some cases, you might develop what we call a side effect. You go back to your doctor and you say, this Imitrex is working really great. I'm no longer getting migraines, but all of a sudden I'm starting to have some anxiety and I'm not sleeping very well. So they say, oh, great, no problem. We're going to put you on an SSRI, which then punches your body over here. And then you go back in and you're like, well, now, I've gained 15 pounds or whatever it is. You end up with some other effect. And so before you know it, the body gets punched in multiple different ways. And then it's kind of hard to tell what's what. So I use this analogy so people can understand. People come into me and they're here. They're punched in some way. They're like, I've got symptoms X, Y, and Z.
Right.
And now, I was trained. I know which drugs would punch the body this way to get them out of, but my job as a naturopathic doctor is to figure out what are all of the things that are punching you to keep you this way. Are there ways we can remove, sometimes it might be a dietary thing. Sometimes it might be, hey, you're eating gluten and it turns out you have celiac disease. So we remove the gluten and the body comes back to normal. Sometimes, in the medicine or the toolbox that I have, I use a lot of homeopathics and a lot of herbs. And what they'll do is instead of punching the body in the opposite way, they punch the body in the same way that the body's going to give it some momentum to help the body come back into balance on its own. So that's kind of like the idea or the principle behind using herbs or kind of the more natural treatments is we're trying to help the body heal because the body wants to be in balance. The body wants to be functioning optimally. So, and sometimes when someone comes in, they're like, oh my gosh, I can't function. I'm taking migraine medicine. We'll keep them on the meds, but we'll say, okay, while you're while we're on this medication to suppress the symptom, let's figure out what's causing it so we can get you off the medication if you want to.
Right.
And, in a case of like, if we're treating anxiety or depression and someone is on, let's say, an SSRI, and, that SSRI is keeping them from being suicidal, we definitely don't want them to come off that medication, but we might be able to alleviate some of the side effects, or, using a diet change, or using a lifestyle change, or, giving them a certain nutrient to kind of help their body build serotonin on its own. Or so basically, like all healthcare providers or people in the healing profession, we're trying to help our patients feel as best as they possibly can using the least amount of medicine, is kind of how I describe it to my patients. That was a long-winded answer, so thanks for listening.
No. It's a. I mean, that's what I wanted. So I appreciate that.
Yeah.
But what I gather from that is sometimes you have people that come to you, and I'd imagine many people in the same field as you come to you on 5 or 6 different medications, and
yes.
sometimes that many meds causes a ton of side effects. And a lot of times what you have to do is try to figure out how to decrease the amount of side effects with still getting the medicinal benefit.
Exactly. That's exactly right. And my, I always, and I talk about this a lot on my podcast, even though I am a naturopathic doctor, I'm not against, regular medicine. I'm not against medicine. I want my patients to feel great. If someone comes in and they say, hey, I've been taking this SSRI for 10 years, don't touch that because I'm a mess without it, but I want to work on my health or my weight or something else. I'm not going to say, oh, you have to take, I want people to feel their best. And whether that's on a med or off a med, that's up to them ultimately. I think one of my favorite things about my role as a naturopathic doctor is I really try to empower my patients with knowledge. So I spend a lot of time in our visit. I want them to understand, whatever condition they have going on, what's happening in their body physiologically. If they are on a med, what that med is doing to them, what the potential side effects could be, what it would look like if we got off of it, just so they understand what's going on inside their body.
Yeah. Generally speaking here, because obviously there's going to be, a percentage of people that do and a percentage of people that don't. But generally speaking, do you think the public understands what it is that you just explained to me as it pertains to what you do as a naturopathic doctor? What's the public perception?
The public perception? Well, I think it depends on which public you're asking.
Exactly. Yeah.
The majority of people have never heard the term naturopathic doctor.
Right.
If you're in LA or California, most people have heard. In Maryland, more people are learning about. I think there is a large interest in holistic and natural medicine, functional medicine. A lot of people have heard that term. I mean, I get patients that come in every day that are taking shopping bags full of supplements that they hear about on Dr. Oz, or, that they watch the show The Doctors and take this supplement, buy this, buy that. So, and I think one of the most important reasons, and I know that we might chat about this later, if you are a practitioner and you want to know when it's appropriate to refer to either a functional medicine doctor or a naturopathic doctor, if your patient is on polypharmacy and is also taking supplements and you don't know what those supplements do, great idea to refer them out to someone. Because I want to say that the training that naturopathic doctors get, and most functional docs, if they've done a good functional program, they get trained in herb, drug, nutrient interactions. And most MD, like I collaborate with a lot of MDs, and they call me and they're like, I've got this patient who's taking 3 meds and they're taking 15 supplements and I don't know what the hell they do. Can you please talk to them? Yeah. Because sometimes herbs are great. Sometimes herbs can be really dangerous. They're not always, like, just because it's natural doesn't mean it's necessarily good for you or bad for you.
Right.
But you need to talk to somebody who understands what action whatever you're taking is going to have on your body.
Why do you think?
I can't remember what your original question was. But
the question.
You asked me about public perception.
Public perception.
So I think the public is generally interested in more like I feel like especially the 20s and 30s, the millennials and whatever the generation behind the millennials, they're very interested in doing things more naturally.
Right.
There is a negative perception for naturopaths. A lot of people think that we're quacks and we don't know what we're doing. And, and that's just, and I think they're going to think that's fine. I don't need to treat them. Go see somebody else.
Go someplace else. There are plenty of options for you. Yeah. Yeah,
there's plenty of options. I mean, the thing is, our country's sick. You know what I mean? And I think some people want to go and be treated naturally, and some people want to go, I think so. My ultimate, the reason I started the podcast is I want people to have as much knowledge as they can about how their bodies work, so they can make empowered health decisions. And whether that's seeing a naturopathic doctor or whether that's seeing, a surgeon, whoever it is, you just want to have as much knowledge about your own health so you can make the best decision.
Yeah, when I think about the term natural, many medications, and correct me if I'm wrong here, you might know more about this than I do, where they come from, but I mean, I'm trained to use the medications, but where they come from a lot of times
Yeah.
is plants.
Oh, totally. Yeah.
A lot of them come from
Yeah, no, what
plants.
they will do is they'll take a plant and they'll isolate a certain component. Most plants have, thousands of different components when you break them down molecularly. Some of them are called terpenes, some of them are called there's a bunch of different names, isoflavonoids, there's chemical constituents. And drug companies will find one chemical constituent and they'll say, oh, great, this chemical constituent is going to bind to this neurotransmitter. It's going to upregulate this or downregulate that, which is awesome. I mean, we learn most of what we know about the human body from plant chemistry or
Right.
in terms of medication. But sometimes the full spectrum plant can have more healing effect because you're not just getting the one compound.
Yeah.
Sometimes the compound that you want, the plant actually comes with the other compounds that mitigate some of the side effects that the one compound in high doses might give you. Does that make sense?
Yeah, absolutely. Yeah, I've known that the most medications come from plants being, I mean, whatever chemicals are in the plants are concentrated and then they're turned into, I mean, there's obviously changes that are made to the chemicals that come from the plants, but they come from plants.
Exactly. Yeah. So not all medicine is bad, not all medicine is bad, but like I said, even sometimes plants are poisonous. Like sometimes herbs, people are like, oh, I take these Chinese herbs. I'm like, well, you might not want to do that because that particular herb might be a little stressful for your liver or hard for your kidney to break down, or, just because it's natural doesn't always necessarily mean it's healthy or good for your body.
Yeah, I agree.
It's just because it's a medication might not. It's just, I think it's all about individual. You got to know what's best for your body.
Yeah, I mean, my overall point in even bringing that up is just, I think you have to go with what works. Essentially,
Yes.
if it's an herb, if it's a medication approved by the FDA, you have to go with what works. But you have to be careful though. So if somebody is using herbs and natural products, I would rather go to you than say an MD that's not really trained in that. I'm not sure if you're aware of this, but we don't get that much training with just herbs or diet or things of that nature.
You don't. I mean, that's what my colleagues that are MDs, they're like, I don't know what to do with this patient. She's taking all these herbs. I don't understand them. And it's you can kind of self-teach yourself some of that, but it's a lot. I mean, I took a lot of classes in botanical medicine.
Right. Yeah,
and
it's a lot.
I'm still constantly studying, like, wait, what is that plant? It's just like with any drug, you have to constantly keep up with the new research and the new, there's new stuff coming out all the time about everything in medicine.
You brought up something so Vanderbilt is, where's Vanderbilt?
It's in Nashville, Tennessee.
Tennessee. And you're practicing now in Maryland. This is more on the eastern coast of the United States. I'm on the West Coast. I'm in Los Angeles. You brought something up in terms of where people are more interested or accepting of alternative medicines versus what MDs do. Have you lived anywhere else or practiced anywhere else where you noticed those differences between, Tennessee, Maryland versus California?
I have not lived anywhere else. I have a sister that lives in LA and I have a sister that lives in Austin. And I will say Austin has a really active community that's interested in alternative health. Obviously, LA does as well.
Yeah.
I've got colleagues all over the West Coast. And as I said, I think there's a growing interest for it on the East Coast, but there's not as many naturopathic doctors over here as there are out West.
I think a lot of that is just I don't know how it happens with the culture of, California being more, we'll say hippie, more hippie-ish versus the East Coast.
Kind of on the forefront of trends. It's funny, everyone's like, oh, that's such a new medicine. I'm like, well, it's actually a really old medicine. It's it went out of style for a bit, but it's actually like what we used to do a long time ago.
Right, very long ago, yeah.
Yeah, it's like when everyone's like, ooh, acupuncture is this new thing. And it's like, no, acupuncture's been around for thousands of years.
Long
it's probably
time.
more research than, most drugs. Yeah. But it's like in a cycle, things kind of go out of fad and they come back into fad. But I feel like California is usually on the forefront of trends, and then they move to the East Coast, and then they move to the middle of the country.
Yeah.
At least for most trends.
Yeah, I practiced on both sides of the country, and it's just interesting to see the dynamic there. So just wanted your thoughts. Yeah. So what can you tell me about this stress reset formula? I was looking at your website. What can you tell me about that?
Well, so I started when I was first in practice. I had a lot of patients come in that I would kind of end up, a lot of people come to me and they've been to see multiple different doctors and they've got anxiety, depression, they've got a whole host of kind of weird, seemingly unrelated symptoms, and all their lab results have come back quote unquote normal. And they end up in my office and they're like, I just don't feel good. And they're like, I don't think I'm depressed, or, they've been told, maybe you need to take an antidepressant, or maybe the birth control pill will help level out their mood. And they feel dismissed. And so I'll end up running some extra tests, looking at neurotransmitters and looking at their cortisol levels. And they have kind of what I call adrenal fatigue. So their adrenals are a little bit burnt out. And usually that's from high levels of stress over prolonged periods of time. And the adrenals, the cortisol levels start to go down, adrenaline levels will rise, and people feel, they feel kind of wired and tired. And labs all look normal, but they don't feel good.
Right.
They're irritable, they're tired, they don't sleep well, they have anxiety, they're, and they're not happy. And a lot of them are either working moms or working women. So their stress levels are elevated. And I started noticing that they did really well on the supplement and or diet protocol that I'd put them on. And I would put them on it and we'd check in a few months later and they'd say, hey, I feel great. I feel awesome. And I would say, okay, great. Check in as needed. They'd end up coming back in like maybe a year to two later with the same symptoms. And they're like, well, the supplements worked for a while and I stopped and then I felt good. And then I started crashing again.
Right.
So I started realizing that and then they would try the supplements again and they wouldn't be quite as effective. I started noticing that it was more of a lifestyle change that needed to happen. Like they were burning the candles at both ends. And I also went through this myself. I had, adrenal fatigue several times. And the first time, I put myself on a supplement protocol and things got better. And then I went back to my crazy lifestyle where I was doing a million projects and not resting. And, how a lot of us high achievers are, we go. And
hard to stop.
Like I tend to crash.
Yeah.
And so I started looking at my own life and I'm like, well, I keep doing this pattern where I keep going. And then I crash and I don't feel good. And then, so I kind of started to develop more of a lifestyle shift that I started implementing with my patients. And I call it the stress reset formula. So it's putting into practice some daily like stress calming practices that help ultimately, boost the adrenal function and help to prevent burnout in the future.
So that kind of leads into my next question. What do you think the most common stressors are for women in 2021? What are the most common stressors that you see?
Their own brain. I think honestly, no. Okay, there's a lot of stressors, particularly in 2020 and 2021.
Yeah. There's one outstanding.
Mom, but I do think that our, as females and men too, and in the current climate, just the worry factor, everything that you have to be worried about in today's world. Like before 2020, if you were a female raising children and working, there were a lot of things that anyone on a given day has to worry about. But I think the pandemic has thrown into play, every time you go out, do I have a mask? Like, is someone going to judge me because I'm wearing a mask or because I'm not wearing a mask? Or, I'm going to go to this social event. Am I going to get judged if I put all of the things that it's like all of this extra stuff we now have to worry about. And I always explain to my patients that no matter what the stressor is, whether you're being chased by a lion or your child's screaming or you have recurrent worrying or anxious thoughts, all of those are going to trigger your stress response. And the physiologic response is exactly the same. So when your stress response gets triggered, your blood pressure goes up, your heart rate increases, all the blood flow goes to your arms and legs, your pupils dilate, digestion turns off, sex organs turn off, hormone production gets turned off. You're just in stress mode. And that's great if you're running from a tiger. But if you're just laying in bed at night, thinking about your to-do list the next day, or, oh my gosh, I didn't wear a mask when I walked in, is someone going to judge me, or whatever the thought is, that's also triggering your fight flight response, which is, sending the whole cascade of stress hormones through your body when you don't actually need it to.
Right.
So I when you ask what the number, I really think it is our own, like we're kind of all stuck in this stress mode because of what we've been through in the past year. And it can be tricky to get your brain out of that habit of thinking. I think if you're able to spend, 15 to 20 minutes a day calming the body, calming the brain down, that's ultimately what we need to do to get out of that mode. I wish there was a pill I could give to, there probably are. We could probably give them, benzos or something, shut off all thoughts, but that's not really fixing the problem.
Yeah, I agree.
It's like putting a Band-Aid.
Especially for right now, just as a psychiatrist, I see this all the time where people are just walking around essentially with a ton of bricks on their back, metaphorically speaking, on their back, and it's just weighing them down. And after a while, you're too tired to move. You're too tired to think. You're
Yeah.
you're weighed down at that point. Your muscles get tired.
Yeah.
Do you use those techniques that you work with patients on in your daily life?
I try to, I meditate every morning. I exercise most days. I journal. I mean, I think I'm just like everyone else when it comes to like myself as a patient. It's not easy to rewire your brain to stop worrying about stuff, but I definitely work on it every day. And it's a practice. You have to work on it every day,
Yeah.
you know?
You mentioned this earlier. I think you had mentioned that you were once one of those people that that were high achieving and overworking yourself. When did
I still am.
You still are?
I still am. I just try to balance it more with the relaxing stuff. I don't think you ever stop becoming a high achieving person. I think that if you're listening and you're someone who's like, yeah, I'm a go-getter, I think you just have to make sure you balance it with enough rest. You got to make sure you prioritize your self-care so you don't end up getting burnt out.
So that you can still meet whatever goals that you have for yourself, but not do it to the detriment of your own health mentally and physically.
Exactly.
Yeah.
And I think sometimes we overlook, and I've done this in my own life, we overlook certain things that are actually stressing us out. And so, sometimes we think of stress as being, emails or work, but sometimes, a relationship with a friend might be really stressful, or someone might be, stepping over boundaries, or I'm sure as a therapist, we see this a lot, or a relationship with a partner or a coworker, sometimes emotional stress, we might not even recognize that it's stressing us out. But so I think the first step to figuring this out is figuring out what are all of your stressors, like what are the things that are draining your energy.
Well, the big thing that you mentioned with your stress reset formula was the fact that you're making behavioral changes. That sounds like that's the biggest thing. And
that's the biggest thing. Yeah.
And
again, it is not the easy thing. It is the hardest thing to do. And like I said, I found it hard to do that just in like, a patient visit here and there. Like people need to be they need to be committed and be like, okay, I'm going to do this program. I'm going to work with you to actually change some behavior.
So you also mentioned that you have a lot of collaboration with other disciplines. We're talking the MDs, the DOs. How often do you find yourself working with those specialties, and what specialties do you oftentimes find yourself working with?
Often. I mean, most of my patients that I treat have, a primary care that they work with, or they have a psychiatrist that they're working with. I don't prescribe meds, it's not in my scope of practice in Maryland. So if someone's on medication, someone else is prescribing them. So, and if they come in, I'm always going to be reaching out and working with that provider. I think it's really important for, if someone's got several different doctors, I think it's important for all of the care providers to at least know the other people that are working, to know what's going on. So so I work in close contact with a couple of MDs. We share a lot of patients. I work with a couple of psychiatrists that, they'll refer me a patient. They'll say, hey, this patient is really interested in getting off of SSRIs. They don't want to, they might want to use some different nutrient supplements as we're weaning them down to mitigate side effects. And so we'll work together to determine what's the best outcome for the patient. And I find that in those situations, it works really well. If the other doc's open and the patient feels really great, they feel like they've got multiple people on their team.
Right. That are interested in their care. That's the big thing.
Yes,
I found it in practice, you mentioned the social aspect. A lot of times people get better just by having someone to talk to.
Oh, definitely.
Express themselves.
Definitely.
Yeah, I do prescribe meds, but in my private practice, I don't prescribe them many meds. I do a lot of therapy and just the therapy itself.
Yeah.
I mean, this is what I've noticed over
the
years.
therapy is so beneficial.
Yeah.
I think, and especially in today's, what we're all going through, everybody needs somebody to talk to. You need someone to hold space for you. There's a lot of heavy stuff that we've all been through this year. And sometimes I think, my patients come in and mostly what we do is just talk. And they tell me about what they're taking or what they're doing. And, I'm often not making too many changes to their protocol. I'm just there to kind of hold space for them.
Yeah. So thinking along those lines with collaboration amongst ourselves and being there for the patient, when do you find yourself referring to an MD or a DO?
So if I'm diagnosing something that I think needs medication, I diagnose a lot of Lyme disease.
Really?
And in some, a lot of Lyme disease. And it's sometimes in cases that I test everyone for Lyme disease because I've caught cases of it where I was not suspecting it. Like I've got a couple patients that had only GI symptoms and I just put it on there as a screening. Turns out they had Lyme. Treated the Lyme and all the GI stuff went away. I've had cases of really extreme anxiety, extreme depression. Turns out Lyme was causing it. So in certain cases with Lyme, I'll refer them out for antibiotic treatment. Other cases, there are lots of different ways to treat Lyme. Depends on the patient, depends on what stage it's in. But so in that case, if I diagnose someone with an acute something and I think they need an antibiotic or an acute treatment, I'm going to send them out. Or if we've tried everything, if someone's coming to me for anxiety, depression, and we've changed diet, lifestyle, we've tried supplements and they're really, really struggling, I might say, hey, you know what, it might be time to take a med. So, I was trained to kind of start with the basics first, then add an herb or, supplement. And if that doesn't work, then go to a medication. Because again, I want my patients to feel better. So if I'm not helping them, I will then refer them out to someone else who I think could.
Yeah, I think that's important for people to hear, because when I first heard you speak, and I heard a few other naturopathic doctors speaking, was in Clubhouse. And I was in the Clubhouse app so I could learn a little bit more about what it is that NDs do. And I don't think that people are telling MDs and DOs that naturopathic doctors are kooks, but we still just don't know. And when you don't know a lot about something, it's foreign to you. So no, that's great to hear. So for anyone listening to this,
we're not crazy. We're not quacks. There might be some of us out there that are, but that's just, in any field, there's some MDs that are quacks.
Oh yeah, there's a lot of,
not quacks, but there's people that are, but I think that there's so many people that need help. And I think that, some people might feel more comfortable coming and talking to someone like me. Other people might feel more comfortable talking to, a surgeon at Hopkins. Again, it just kind of depends on the patient's comfort level. And I think as long as providers want to meet patients where they're at, we should be able to all work together, know?
Yeah, agreed. So for people that like what they're hearing now, you have a podcast that other people can go and listen to, titled The Dr. Kinney Show. Could you tell us a little bit about your show? Sure.
So I started the show. I've been on social media for a while. I do a lot of Facebook videos and Instagram videos, and a lot of my patients were like, you should do a podcast. I want to listen to you while I'm cleaning or whatever. So that was my 2020 project. And my ultimate goal, I think I've mentioned this earlier in the show, is that I really just want people to feel empowered about their health. So my goal is to, I have other experts on the show and we discuss different topics. And so people can get more knowledge about what's going on in their body. So we've covered, certain diet topics. We've covered postpartum. I've got next week, someone's talking about kids and ADHD health. So I'm covering a whole host of different topics. So if you're interested, come follow and listen.
How would you describe the experience of being a podcast host? Just the experience.
It's fun. I learn something every time I interview someone. So I'm really enjoying it. I'm kind of looking at it. I'm like, oh, I wonder if I could get CE credit for this. It's like every interview, I'm like, oh, that's so interesting. But it is, I will say, and you've been running one for a while, so it's different to be the interviewer than to be and I've been on a lot of podcasts. I've been interviewed a lot. I feel really comfortable, but it's been different to be in the role of asking the questions. I've enjoyed it. Sometimes I'm like, oh, I didn't do a very good job steering this conversation.
That's that high achieving part of you, just always self-critical.
Exactly. That's that negative thought I need to get rid of. Yeah, that's the stressor, right?
Yeah, people didn't hear us talking before we started recording and everything. Yeah, we're always just looking at everything, just hoping things get better with the next episode. Do you have, where do you see the show going in the future? Are you planning on doing this for years or just seeing where it goes?
I was going to see where it goes and see how it does. It was kind of my, so I didn't really have, my intention was just to, put out more information for people that are interested in learning more about alternative health so they can come and get more information about how their body works. And so, I'm going to see where it goes. So far, I've enjoyed it. I think I've released 7 episodes, so it's still pretty new.
All right. Yeah, I agree with that plan. Just got to wait and see what happens. How often do you put out episodes?
Every week.
All right. Okay. So weekly. Is there a particular day in the week that you put out episodes?
Mondays.
Okay. All right. So for anyone that wants to listen to the Dr. Kinney Show, and what platforms can you be found on?
Spotify, Apple, Stitcher, Google, all the platforms.
All the big ones.
All the big ones. Yeah.
And in your private practice, you're in Annapolis, Maryland.
I'm in Annapolis, Maryland.
If they want to
I
find
work
you,
virtually. So if you want to
yeah.
find me, best place to go is my website, which is drkinney.com, or you can follow me on Instagram. I'm pretty active there. I'm also on Facebook. I'm on Twitter, but I'm not very active on Twitter. Yeah, so come follow. Like I said, listen to the podcast. You can watch videos. Like I'm really passionate about sharing more information about how the body works and how natural treatments work. And
Fantastic. Thank
yeah.
you for, I really appreciate you stopping by, because I think it's important for, myself and colleagues and anyone that's listening, trying to find care, to understand all of their options for treatment. So I think you did a great job explaining what it is that naturopathic doctors do. So I appreciate you stopping by.
Thank you so much for having me. It was great.
Absolutely. All right. Bye-bye.